one of the current problems with endometriosis is how difficult it is to diagnose. So the diagnostic delay between first onset of symptoms and an actual diagnosis from a physician can be, many years, 5 to 7 years. And part of the problem with that is the heterogeneity of symptoms that endometriosis can present with. So it can be completely asymptomatic and be discovered sort of incidentally during treatment for infertility or something, or it can present with super debilitating pelvic pain and really have a big impact on the patient's life. So it's really the sort of lack of consistent presentation of endometriosis that's one of the biggest problems with diagnosing it.
Sure. I mean, neither of us are clinicians. Really, Dr. Judice is the physician scientist who's a collaborator on this study. But from what we've seen, it is very challenging to diagnose. It's also very challenging to treat. Um, and this project, while it doesn't directly impact the diagnostic trajectory or treatment, it allows us to learn more about the heterogeneity of the disease and ways that it can present clinically that can further inform diagnostics and therapeutics moving forward. So maybe we can talk a little bit about the study itself and what we've done briefly. I don't know, Mayor, if you want to jump in and summarize, and then we can talk about how it can help patients.
Yeah, sure. So, I mean, uh, many endometriosis patients report a wide range of other health issues, but previous studies on this topic have been pretty small in scale or focused on specific sets of comorbidities. So we tried to take a more comprehensive approach by using electronic health records from patients from many medical centers. And in doing so, we can both confirm known associations and point towards potentially new ones. After, this process, we identified hundreds of health conditions that are significantly associated with endometriosis. And these range from like reproductive disorders and autoimmune diseases to things like migraines, asthma, and gastrointestinal disorders. And many of these conditions and associations are present even before a formal endometriosis diagnosis. So that's, one of the overall findings of the study is just the range of conditions. I don't know, Marina, you can maybe talk about some of the implications.
Sure. So basically, this allows us to understand what might be the subtypes of endometriosis and how clinicians can better understand when a patient comes to them with a certain array of symptoms, and they might not even think it might be related to endometriosis. They can understand better. Also, Umair did a sub-analysis that looks at the diagnostic landscape for patients before they actually get diagnosed with endometriosis, and that can inform further diagnostic strategies. So you can imagine as the next step of this study, potentially applying machine learning and predictive modeling, AI, whatever you want to call it, to these types of data to understand which patients, just from a general population, are more likely to develop endometriosis. And that might hopefully reduce that diagnostic journey from what it is now, which is 5 to 7 years, to a much shorter time. So we can use what we use here as electronic medical records, which is data that gets captured when a clinician sees a patient in the clinic. And we have to understand these data are not necessarily collected for research purposes. They're collected mostly for billing as well as everyday clinical care to track the progression of the patient. We are able to de-identify these clinical records and use them for research in a very safe way, in a way that the patient data is safe from anything. And what we've done here is we've described the endometriosis population. What does it look like from the clinical profile of these patients using comorbidities or other diseases that they might present with? Now, you can imagine to leverage this type of data further to see if we can actually predict using machine learning which patients from, any patient walks through the door, who is more likely to develop endometriosis. And we've done similar work for other complex diseases such as Alzheimer's disease. We can also expand to use more than just the diagnosis codes. We could explore medications that these patients are on. We could explore lab test result values and look at a clinical profile more comprehensively.
Yeah, and to add on to that, I think more recently we with these new large language models, we're also able to get a lot more sort of rich information out of the clinical notes, which could also be a really interesting add-on to the kinds of data that Marina described. And I think, the end goal is with all of these different kinds of rich data available to us through the EHR, we'd be able to hopefully develop some kind of model that can look at the patient's profile and sort of assess how likely an endometriosis diagnosis is. Although that's, obviously a long way off at this point.
It's an exciting time. Here we're using clinical data, and we've been able to learn quite a bit about the disease and the way that it manifests itself clinically, or the way that information gets captured in the record, and try to understand it a little bit better. Some of the clusters that we identify persist across time, which is really interesting. And also the results are very robust across different clinical centers. So here the discovery was done at UCSF, but the validation was done across the state of California. Of course, future work is to also look at what does this look like in other settings, in other um, places across the US and other places in the world as well. And I would say the ultimate kind of future work for me would be to overlap some of these clinical data sets together with molecular data that we might have on endometriosis patients. Let's say some of them had a biopsy, and maybe we profiled those biopsies with molecular measures, and then we can understand and bridge these two, which is some things more on the discovery science together with what we see in the clinic.